Hello, good evening, guys. Hello, am I audible, guys? Almost in last class, we discussed 18 questions, right? Hello. Hello, everyone. Am I audible? Just message me, guys. Yes, Srijaya. Okay. Already we completed 18 questions in the last class, so let us discuss 81. Question number 81. Okay. So, yeah. A physician documents that patient has been non-compliant with medication and has only been taking half dose to save on money. So, what will be the answer for this question? What is the answer, guys? Just drop your answers in the comment section. Okay, Jiten. Vanakkam, Akash. Yes, B is the answer. Yes. Okay, B is the answer. Very good, Akash. And darling, very good. Okay. 82. A patient is seen by the ENT for chronic ethmoidal sinusitis. So, what are the appropriate ICD-10 for? Rasna Rashi, yes, 81. B, correct answer, dear. Okay. H2 B, Akash, correct answer, dear. What about others? Super Akash, correct answer. Yeah, Rasna Rashi, correct answer, dear. Okay, 82, correct answer. Darling, correct answer. Okay, nice, guys, nice. Okay, okay, so yeah, 83. The patient is diagnosed with post procedural hypertension. What is the appropriate ICD-10 code? Jidin, correct answer, Jidin. Very good. Okay, the answer, yes, 83, option B is the correct answer. Very good, Jidin. Nice job. Yes, darling, correct answer. Yes, B is the correct answer, dear Agash. Correct, correct, correct. Okay. Yeah, Rasna, correct answer, dear. Uh, yes. Okay. Okay, Rasna Rashi, correct answer. Yeah, 84. Let us check the 84th one. A 14-year-old patient is seen for a red scaly crusted rash on his trunk. The patient is diagnosed with ringworm. So, what is the appropriate ICD-10 code? 84 B. Okay. Please check the code, guys. B35.9. That is the answer, or B35.4? Let me check once again. Actually, what is B35.9? The code for a dermatophytosis unspecified condition. But in our question, ringworm is mentioned, right? So B35.4 for a ringworm of the body. Correct answer, guys. Okay. B, correct answer. Akash Kumar, correct answer. Rasna Rashi, correct answer. Darling, correct answer. Super. 85. Patient present with runny nose, stuffy head, frontal headache, and sneezing. After the exam, the physician diagnoses allergic rhinitis and sinusitis. So, what is the appropriate code for the 85D correct answer? Akash? Okay. 86. A patient is seen for wheezing and cough for the past 2 years. Sorry, 2 days. She's using her rescue inhaler um, daily and has not been able to work out for about a week. Due to the cough, she is diagnosed with moderate persistent asthma. What is the appropriate code? Okay, darling A, Rasna Srijaya, everyone says option A. So let us check the code. J45.40, correct answer, guys. Okay, darling, correct. Rasna Srijaya, Akash, correct answer. Okay, 87. Patient present with abdominal pain, low grade fever, and some nausea. Exam reveals rebound tenderness in the RLQ. The physician suspects appendicitis and the patient are sent to lab work and radiology. So, what are the appropriate code? 87 answer is option A. Darling, correct answer, dear. Yes, Akash, correct answer. Okay, so other question 88. A 4-year-old patient present for her first eye exam. It is found that she has a bilateral optic disc drusen. What is the appropriate code? 88. Shrija 87. Okay, correct. Sanjima, correct answer, dear. Okay. What about 88? Agash, correct. B is the correct answer. Very good. Rasna, correct answer. B, correct answer, guys. H47.323 is the answer. Okay. Actually, the code it is for mentions the diagnosis, optic distribution. Okay. Yeah. 89. A patient is hospitalized with pneumonia and culture indicates it is due to Escherichia coli. So, what is the appropriate ICD-10 code? Darling, yes, dear. 88 option B, correct. 89, what is the answer? B, correct answer. Rasna, correct answer. Darling, correct answer. Just check your code. B is the answer. Okay. J 15.5. Yeah, Mohini, are you there? Yeah, correct answer, dear. B, second one. Mohini Patel. 19th one. 3 days following an open herniorrhaphy, Thomas is admitted after collapsing at home. After examination, it is determined that has developed E. coli septic shock due to leak in anastomosis at the previous repairs. So, what is the appropriate? Shrija, correct answer, dear. The previous question 89, option B. Okay, Akash. What about the answer? D is the answer. Srijaya, correct answer. Mohini, correct answer. D, last one is the correct answer. Okay. One, a patient with pemphigus flaccus foliaceus. Okay. Comes in for a checkup. The steroids are working well at getting her skin condition under control. So, what is the appropriate ICD-10 code? Actually, guys, it's a live sessions. Okay, I'm not explaining detailing each and every questions. Okay, just questions only. Okay, in this session, I'm just scrolling questions only, not the class. Okay, if you are interested to join my 10-day CPC workshop program, in that program, I will explain everything, each and every questions with clear. Okay, you can join. Okay. 9037038006 is my number. Okay, are interested for our CPC coaching? Just message me. It's a 10 days of coaching. Okay, full of more question papers, discussion, doubt clearance, everything is there. Okay, and separate chapter wise questions discussing. Okay, everything is there. I just pinned my my number in this comment box, okay, in this chat box. So if you are interested, just DM me. I'm just messaging my number. Um, yeah, I just pinned my number in the chat box. Okay, just message me. Um, no more others. I just pinned my number. Yeah, what about the answer? 91, 91 C. C is the answer, guys. Yeah, good. Rachna, correct answer. Akash also correct. First comment, Agash. Rasna, Srijaya, correct. Others, please check the code, guys. Okay, 91 CL 10.2 is the correct answer. Yeah, 92. Sally returns to the office for a joint injection for pain relief of chronic right knee pain. What is the appropriate ICD-10 code? Srijaya, just check the code, dear. Yeah, Mohini, correct answer. C is the answer. Very good. Okay, C is the answer. G89.29, M25.561. Okay, actually, pain relief of chronic right knee pain. Okay, is mentioned. So G89.29 and M25.561 is the correct answer. Yes, that's the correct answer. Yes, Redipa, correct answer. 93. A patient is seen for surgery for a fracture to the right hip. What is the appropriate ICD-10 code? 93, what is the answer? Um, yes. 93, answer is Akash. Just check the code. Yes, answer, exact answer for 93. What about others? 041 is right. 001. Which is correct? Check option A and B. What will be the appropriate code, accurate code? And guys, if you want to if you want the December month question paper, you just check my playlist. Okay, December month playlist. I will upload almost 4 to 5 videos in my playlist. Okay, December month playlist. Do check it out. Okay. It is in my video session, YouTube channel video session. Deepa. Deepa also saying B. Okay, let me check the code. Okay, just a second. S72.041. Actually, the code S72.041 is for a red. Check the code, guys. The code for displays a fracture of the base of the neck of the right femur. Hip bone is mentioned. Okay, and what about 001? 001A. Fracture of the unspecified part of the neck of the right femur. No, actually, option. Yeah, here also hip, right hip is mentioned. Okay, B correct answer, guys. Yeah, I have mistaken. B is the answer. Srijaya. No, actually, 001 is unspecified part of the neck. But here, right hip is mentioned here. Okay, so answer is option B. Okay, that is for a base of the neck of the right femur. Okay, wait. 018. It's confused, guys. It is for right femur, right? No, actually, uh, displaced fracture is mentioned in the option B, 041A. Right femur is mentioned. But in our question, it is right hip is mentioned. Hip, not a femur. 001A. It is for unspecified part of the neck of right femur. Initial encounter for closed fracture. Hip. Yeah, okay, actually, here hip fracture is mentioned. So for hip fracture, option A is correct. A is the correct answer. A. Yes, Jidin correct answer. Darling correct answer. Srijaya correct answer. Deepak correct answer. Reddy Kappa correct answer. Deepa correct answer. Agas check the code. Okay. No, actually, hip is not considered as femur. Check the code clearly, dear. The code specifies the hip fracture. The code, S72.001A. The code defines the fracture of an unspecified part of the neck of the right femur. Initial encounter for a closed fracture. The code specifies the hip fracture code. Okay, hip fracture code. It is a hip fracture code. Okay. Check carefully, Monica. It's been long time, Monica. Question 94. A patient comes in vaccinations. Look for the correct ICD-10 for the encounter. Vaccination code. What will be the answer for 94th one? Correct answer, Monica, is a 23. Correct answer. Others also. Akash, a correct. Mohini, correct answer. Rasna, correct. 95. A 26-year-old patient present for gynecologic exam during the pelvic exam tenderness is noted over the right Jidin Reddy Kappa. Previous question answer correct. Do this 95. What is 95? C is the answer. C. No, Akash, check the code. Rasna, check the code. Darling, check the code. Monica, correct answer. Mohini, also correct. Okay. C is the answer for this question. 96. If you have any doubts related to any question, already these videos are saved in my live session. Okay, in my channel. So do uncheck it out. Okay. 96, a symptom code would not be used with a dash diagnosis if the symptom is integral to the diagnosis. No, Monica, check your code. That's not a proper. No, Akash, C is not. D is the answer. Definitive. Definitive diagnosis if the symptom is integral to the diagnosis. Definitive is the answer. Okay, definitive is the answer. Okay. No, Srijaya, just check the code. Okay, let us check the 97. What is the ICD-10 code for acute diastolic heart failure? Jidin, D is the answer, dear. Previous question. Symptom code should not be used with a dash diagnosis. Definitive diagnosis if the symptom is integral to the diagnosis. Okay. Yeah, Reddy correct answer. Sri J also correct. What about 97? D correct answer. I 50.31. Yeah. Okay. I 50.31. 50.31 correct answer, guys. Yeah, 98. A patient complains for a pain in her feet. She was type 2 diabetes and is diagnosed with diabetic related neuropathy. Akash also correct. I forgot to share. Two of my students were passed in her CPC examination in last Saturday. One of them got 85 percentage and other got 90. I'm so happy. Yeah, it's a happy news for me. 98. Yes, A is the answer. Agash. Agash. Yeah, Monica. Correct. E 11.40. Prasna Rashi. Correct. Okay, Akash. Thank you. 98. A is the answer. Yeah, Deepa. Correct answer, Deepa. 99. 99, 6 months ago, Mary tested positive for HIV but has been symptom free. Today, she presented to the physician and is diagnosed with acute tonsillitis. So, how will you report? Okay, mistakenly type. Okay, Adarsh. No worries. C, D, correct answer. Monica, correct answer. Darling, correct. Others, please check the code. Jidin, no, dear. Actually, D is the answer. Okay. Option D. Okay, dear. Check the code. D. D is the answer. Darling, Monica. Correct answer, guys. Check the code, guys. Yes, Akash. Last question of this PDF. 100. Michelle is being seen by Ubi or Gain with postmenopausal atrophic vaginitis. It is oh, Deepak Mohini, previous answer correct. Yeah, Rede Kopala, correct answer. Akash, very good. C, 100 answer is C. Super. Okay, correct answer. Okay, Rasna Rashi, correct answer, dear. Nice. And yeah, almost we completed this ICD paper, 100 ICD papers. Guys, if you are missed any papers like any questions, do check it out in my live session. Okay, do check it out in my live session. So yeah, and also I uploaded December month recent December month questions in my YouTube channel playlist. Okay, so just check my channel, guys. If you want that, if you want the playlist link, I will just mention in the comment section. Okay, just a second. Mention it in the comment section. Yes, guys. I just mentioned the. I just shared my playlist, YouTube playlist, December month full questions in the in through this comment. Okay, just check it out. Okay, and if you want any, Deepa, correct answer. C. If you have any doubts related to my 10-day CPC workshop program, just DM me. Okay, just DM to that number. I already pinned my number. Okay, just message me. I'll share all the details. Actually, Monica, it's a live session, dear. Okay, not a, I already told you about that a lot of times because இதுல வந்து everything was not explaining. Okay, just sharing the questions only. Okay, so உங்களுக்கு டீட்டெயில் ஆன கிளாஸஸ் வேணும்னா உங்களுக்கு என்கிட்ட மெசேஜ் அனுப்பலாம். ஓகே, for 9037038006 is my number. Just drop a message. டீட்டெயில் ஆன கிளாஸஸ் நான் 10 days CPC workshopல தான். Okay, so it just scrolling பண்ணி தான் போதும். Times I already asked it. Okay, yeah. Mahesh, correct answer. C is the correct answer. N95.2 correct answer. அதுதான் மோனிகா. ஆக்சுவலா டீட்டெயிலா இந்த லைவ் கிளாஸ்ல நான் கொடுக்க மாட்டேன். ஜஸ்ட் கொஸ்டின்ஸ் மட்டும் ஷேர் பண்ணேன். ஓகே, வேற ஏதாவது டவுட்ஸ் உங்களுக்கு? If you have any doubts related to CPC exam also, you can just drop a message. Okay. Okay, ready. January month. Okay. Congrats. And all the best for your exam. Okay. January month 2026. Okay, little bit changes in your exam. Can expect a little bit changes there. Okay, otherwise everything is okay. Same pattern, same CPC pattern is almost same. Nothing new changes were not happen. Okay. Okay, guys. So see you in the next session, next live. Okay. Bye. Good night.